Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning in to this installment of the Ask Dr. Tony series, where everybody's favorite expert on autism and Aspergers, Dr. Tony Atwood, addresses your questions about autism. Welcome, Dr. T. It's nice to have you back.
Oh, thanks, Craig. Thanks for that wonderful introduction. I'm very privileged.
Well, there's so many people that have such an interest in you. Your show remains one of the most popular shows at Autism Hangout, and it's for you giving back to the community and helping us all learn how to thrive with autism. So I thank you for taking the time today.
Oh, it's a pleasure. It's a pleasure, Craig. Okay, let's get rolling. Let's find the first question.
Yeah, we have 13 of them tonight, and they're not all from Autism Hangout tonight. There's actually a couple that came in from YouTube. The first one is, Dr. Tony, I have 3 Asperger kids aged 7 to 9, and all 3 visit a regular school and communicate. They're not hyperactive, they're quite intelligent, but all 3 suffer from bedwetting. Is this common in Asperger's and autism? And this is from Autism Hangout member AF3.
Answer is yes, it is quite common, and several things we look at. Obviously, in the typical population, we look at things like anxiety and so on. That may be a factor, but within ASD, there's another 2 components we look at. One is sensory sensitivity, or should I say, lack of sensitivity. Mm-hmm. Usually we associate this with the auditory sensitivity or touch sensitivity, but there can be a lack of sensitivity to pain and discomfort. So toileting accidents occur. These can occur in the day, but also at night. In other words, the brain is not picking up the signals of, you need to go, until it's too late. Another component that happens in ASD is an altered sleep profile. And we're now identifying that that sleep profile can be picked up in infants. It's one of the things we look for early diagnosis. But there can be such a sleep pattern of deep sleep that in a way that the brain is switched off and these automatic functions occur. So I would check, first of all, on the sensory issue. Is that person less sensitive to pain and discomfort? They're not getting the signals. You need to have a bell go off in the night, an alarm clock, to say you need to go to the toilet because the signals aren't getting through. Mm-hmm. The other option is to have a look at a sleep clinic to see if there's anything that's happening in their sleep cycle that may be affecting them. So all I can suggest is, yes, it's a very serious problem. Most get over it. It's not necessarily a lifelong problem, but I think you're going to need medical help for the sleep problem. Sensory sensitivity, maybe an occupational therapist for a sensory assessment.
Mm-hmm. Interesting. Yeah, it is common. So for those of you out there that are suffering this issue, it's part of what you find with autism. Question number 2, what is the correlation between Asperger's and eating disorders? And this came from Buffheart at YouTube.
Okay, quite common again. Eating disorders for a variety of reasons. One is obviously the sensory sensitivity. Food is a sensory explosion of aroma, taste, texture, liquidity, noise when you crunch it, etc. So sometimes there's an aversion for food because of the sensory experiences being so abhorrent. I don't want to try anything that could give me that horrible sensation again. So the person tends to have a restricted diet. Their lunchbox is always the same food. But in the teenage years, you can get what I call Asperger faulty logic and pick up an idea. And for example, earlier, a little while ago, I met someone who has anorexia nervosa, a young woman. And when she was at school, she found that one day when she'd skipped lunch, in that slightly feeling hungry, she had better concentration. And she thought, if I have less food, I'll be able to better concentrate on schoolwork. Or another component can be that food, because of the sensory sensitivity, etc., becomes a major feature of that person's life, that it eventually becomes a special interest. Mm-hmm. And so the person has a special interest on calories or kilojoules, their weight and numbers and control. In other words, so eating different types of food, the tables that give you all that information, becomes a special interest, and they, shall we say, develop an experiment on their own body about weight. Mm-hmm. So you can get anorexia nervosa occurring, but the origins can be very different.
Mm-hmm. Interesting. The next question is from a teacher. He says, "Hi, Dr. Tony. I am a teacher, and I've recently discovered that I have AS. I am licensed for middle and high school programs, but I'm wondering if I should adjust to teaching at the middle levels or as a college professor who can run on about a favorite subject and be fondly accepted for eccentricity. What have you seen in your profession? What would you advise? And this is from Sleepy at Autism Hangout.
People with Asperger's syndrome not only can be very kind, but they can be very determined to help others. And the teaching profession is an ideal one, and it's one that I recommend for people with Asperger's. However, teenagers are toxic to those with Asperger's syndrome. They're toxic when you've got to go to school with them, but they also seem to have a dislike of adults. Their main aim in life is to give the teacher a nervous breakdown and to bankrupt their parents.
Oh.
So as far as the sort of teenagers are concerned, sort of grade 7, 8, 9, etc., they're not good for those with Asperger's because they are artful, malicious, nasty, horrible. I think all grade 8, 9 kids should quit school in Australia, go into the desert. If they survive for 2 years, then they're allowed back, because they're not going to learn anything. They're a waste of time. So I think whoever this is a very sound judgment that either younger children that are more respectful are likely to be more compliant and the person goes very well, or, as you say, a college professor, that you take an ability, but those in the class want to be there. Teenagers don't want to be there, and you're like a jailer in a prison, and they hate you for it. So if you're prepared to continue, all I can say is the British would say, you're very brave. But I think if you're a great teacher, check that you're with a group of students that want you there, is all I can say.
Uh-huh. Geez, that's great advice for Sleepy. So Sleepy, I hope you do either go for the younger crowd or go on into teaching college. That's great.
Yeah.
All right, there's 2 questions now coming up from Inky. Inky says, hello, I have a 24-year-old female sister that has been discriminated against because she's on the spectrum. And in battling for her rights with the legal system, she has become very anxious. In a stressful, ongoing situation like this, what can a loved one do to help them deal with the anxiety and give them support? And is there anything that the legal system can do to accommodate her special needs so she doesn't get misunderstood or brushed off?
Okay, good question. The legal profession is one of the most conservative organizations you could possibly imagine. And it'll take them 2 to 3 decades to really recognize the characteristics of Asperger's syndrome. Mm-hmm. What they may recognize is intellectual disability or psychiatric illness, but Asperger's is quite alien to them, which is ironic because I know a number of very successful judges and people in the legal profession with Asperger's syndrome. Now, it's also a different culture. And those with Asperger's find it very difficult to adapt to the new culture, the language, the style, etc. So they have a double problem in this. It really does require having legal representation that understands Asperger's syndrome, but has a way of explaining it to a judge, the court process, etc., as to what's needed. Now, as a clinician, I'm often involved with helping people give evidence. They may be charged with various offences and so on. And there can be all sorts of issues of not understanding the nuances, the complex language, the culture, all those sort of games that are played in court. Mm-hmm. Courts have nothing to do with justice and truth. It's a game, basically. Mm-hmm. And if you don't know the rules of the game, then I'm sorry, you're going to lose. So I think she needs someone who can help her in 2 fronts. To explain the culture of the legal system, almost as though she was in a foreign country, a bit like Tara Gray's social stories. She's going to need legal representation that is aware of her confusion, and if she is going to give evidence, etc., the more agitated, concerned and upset she is, the less coherent the information she will provide, and so they need to have the ability to calm her down and support her. I hope that she can continue, but often an approach in the legal system is a war of attrition, and hopefully somebody collapses. However, from my clinical experience, people with Asperger's can, as a matter of principle, keep going. Mm-hmm. They can be very dogmatic and determined and need to be recognized as such. So that's what I would suggest for the reply to this question. Mm-hmm.
So stay the course, but find the advocate that understands ASD and can explain it best to a judge.
Yeah.
Okay, my 24-year-old sister continues to suffer emotional flashbacks from several anxiety-producing doctor visits. During these visits, her anxiety went so high that it overwhelmed her ability to answer questions appropriately. Now, she deeply regrets these incidents. However, now she's become self-deprecating over them. She calls herself an idiot or stupid for her unusual behavior, which was clearly brought on by the stress. This negative self-esteem issue is alarming. Is this post-traumatic stress disorder? She's on Celexa for anxiety, but it doesn't appear to be helping. More important, what can we do to help her? Again, this is from Inky.
Okay, the common characteristic, more so in the women with Asperger's than the men, is in anxiety, elective mutism. In other words, they're so anxious they are frozen and can't speak. Now that's because of the severe anxiety. Fight, flight, or freeze are the three particular options. Now she may have frozen and be tongue-tied, tripped over her words, or couldn't speak, but that's due to anxiety, not stupidity. The next part that what she's done is blame herself. That comes from past experience of other people being critical of her. And she's internalized the criticism of her peer group or teachers. You're stupid, you're bad, you don't know. So she's internalized that process, so her reaction is to blame herself, and she shouldn't do that. It's in a way a bit like PTSD, but it's not a classic PTSD, it's more of an anxiety issue that's occurred here. What can be done to help? I think by explaining why she couldn't speak, it's not a sign of stupidity, not to self-blame. But also I think what can be done is that if she has to go to a doctor or somebody else again, that she has an opportunity to explain her difficulties and relax and take her time in what she's got to do. So it's a learning experience, and as such, next time she goes to a doctor, etc., could she have someone with her that could keep her calm and speak for her if she feels tongue-tied?
Excellent.
Also, I would recommend, this is what I do whenever I have a clinic appointment, those who have been to my clinic know this, I always tape record or record on CD all our conversation. So the person with Asperger's goes away with a full record of everything we went through, so that you don't have to rely on verbal memory, auditory memory of what I said. Now, I've got a cup of tea. I'm just going to take a slug.
Okay. Take your time.
Well, we British, we need this. Well, I'm Australian now.